Hi, I'm Dr. Joe. I'm glad you joined me again for this kitchen table chat. Let's review how you test for yeast infection. Maybe you've been doing a little reading about the yeast overgrowth problem and you're really wondering if you have it. And you know what? Yeast can be a part of a great variety of symptoms. I call it the great masquerader, so it is a good idea to look into this and see if you may have yeast overgrowth in your body. You know, I wish I could tell you there's this, go get this one test and you'll know for sure you have yeast overgrowth. I've wanted a test like that for 30 years now, but as far as I know, none has been developed yet. And that's because we all have yeast in our body. It's a normal part of the balance of organisms in our gastrointestinal tracts and on our mucous membranes in our respiratory tract. So it's difficult to differentiate in a test whether we're getting the results from just the normal organisms that are in the body or that there's an overgrowth. But there's some tests that can give us some ideas, and hopefully you'll find a doctor who's very knowledgeable about the yeast overgrowth problem and work with her or him in looking into some of these tests. First of all, the old standby that I used 30 years ago when I first found out I had yeast overgrowth was Dr. Crook's Candida questionnaire. Now, Candida is just another name for yeast. It's actually the scientific name for yeast. So go online and look up Dr. Crook's Candida questionnaire. Go through it, take the test, score it. You'll get a pretty good idea of whether yeast may be a problem for you or not. Candida is spelled C-A-N-D-I-D-A. Now, again, it'd be nice if we had a blood test that would say we have yeast overgrowth. Blood tests may give us some clues. Probably looking at the Candida antigen level is one of the better tests. The antigen is a piece of the yeast cell membrane. So it's part of the yeast. We're measuring part of the yeast. And if you measure the quantity of Candida antigens in the blood, that might give you a clue about yeast overgrowth. There are also antibody tests. Again, sometimes if you get all three antibody tests, the IgG, the IgA, and the IgM, it may give you some clues too. The IgA levels of antibodies tend to correlate with the yeast growing on the mucous membranes. The IgM antibody levels tend to pop up high when you first get a yeast overgrowth. The IgG antibodies hang around for a long time, so you don't know how long they've been high. So these tests can give you some clues. They're not totally conclusive. Another test that holistic physicians find very valuable is called the Comprehensive Digestive and Stool Analysis. We call it CDSA for short. Well, as you can imagine from its name, it looks at how well you're digesting food. And if you're not just digesting proteins down to amino acids and fats down into fatty acids, it'll show up in your stool test. Then your doctor may suggest you take some digestive enzymes. You may also even need hydrochloric acid to help digest protein better. Generally, the comprehensive digestive enzymes cover protein, carbohydrates, and fat digestion. The CDSA also includes cultures for bacteria and other fungi and yeast. Candida isn't usually the only culprit. when the organisms are out of balance in your body. A lot of us have fallen into this yeast overgrowth, Candida problem after taking repeated courses of antibiotics for recurrent infections. And in the process of killing off the bacteria that was giving us a problem, it kills off a lot of the normal friendly bacteria too, and that allows other unfriendly bacteria to grow, or other yeast and fungi besides the yeast. So the CDSA can give your doctor some ideas about other problems that may be going on in your body too. Now it also tests for the level of the friendly bacteria, the Lactobacillus acidophilus and bifidus in your gut. And if those are sparse, of course you'll want to replace them. That's called probiotics, and you're probably aware of probiotics. They come in capsule form, or if you're able to eat cultured products, you can get them from cultured foods too, like yogurt, although I find a lot of people with yeast overgrowth just don't even handle yogurt because it's a bit difficult to digest, or because you become sensitized to the milk product. But anyway, your doctor will help you figure out what probiotics to take. Another big culprit that I found when I was working with people with yeast overgrowth problems is that they also had parasites. Now, parasites are very elusive, and most laboratories, as good as they are, do not detect parasites. I knew some special labs that were good at detecting parasites when I was in practice, and we uncovered parasites in lots of Americans. You don't have to have gone out of the country to have a parasite. It can be an amoeba like Giardia that you can get from drinking water out of streams. It can be a roundworm. You can actually pass those around from person to person, or any other kind of parasite. And just keep that in the back of your mind. It's something, if you don't get full recovery from dealing with the yeast, maybe you should talk to your doctor about checking for parasites. Now, talking about making a diagnosis for something that's difficult to detect, like the parasite, I discovered another way of practicing when I was finding out what was going on in people's body without having to use blood or urine or any of those kind of tests. Our bodies are just amazing in the way they're made, and although most Americans don't recognize it, our bodies are electrical. There is a physics part to our bodies. Now, you do know that the EKG, the heart EKG, is a measure of the electrical activity of the heart, so you kind of have an idea that there are electrical impulses in the body. And because of that, it creates an electromagnetic spectrum around our body. And so we could do some testing and just look at the way your body responds, how the muscles respond to the input of certain stimuli, and get a pretty good idea of what organs were having problems and what was causing the problem. And it's awesome. It's an awesome way to test. The way I learned to do it is called Autonomic Response Testing. Other doctors may use a different type of energetic testing, but it's a very valuable tool. So in your search for help with the yeast overgrowth problem, look for doctors that are knowledgeable in testing the energetic systems of the body. I know I've probably just piqued your curiosity about this, and I just love to tell you everything, but we can't do it in this short video. But there are lots of other resources, and I've included a lot of those in overcoming yeast infection. So if you'd like some more information, just take a look at overcomingyeastinfection.com, and especially the link connected with this video. Anyway, it's been great chatting with you, and I look forward to talking to you again. You have a great day.